Hello and welcome to Filibusters in Fine Print, where AMGA's public policy team gives you the insider view on healthcare regulations and legislation. Thanks so much for joining us for the latest from Washington, D.C.
Good morning and welcome to Filibusters in Fine Print, AMGA's public policy podcast. I'm your host, Chet Speed, and I'm with our expert panel today. We'll lead with you.
Jamie Miller, Senior Director of Government Affairs.
Alicia Sawyer, Government Relations Assistant.
Hi, everybody. My name is Daryl Drevna. I'm the Senior Director of Regulatory Affairs.
Outstanding. And again, Lauren Latney is now with us because she is doing her civic duty as a grand juror. As mentioned before, she likes the grand part of that jury duty.
Do you get to wear a robe when you're a grand juror? Or like a
Powdered wig?
powder? No, that's Canada does that still, right? And so
I think England does as well.
Yeah.
Yeah. No, it's
As a juror?
as a barrister,
barrister.
or a judge.
Okay.
I do believe. Yeah, juror. No, I don't.
Yeah. I was like, wow. Second
Jurors
look
get-
at jury duty.
Yeah, jurors get $7 a day in DC, so
Oh,
it is quite the bargain.
yes.
Anyway, I'm sure she's doing an outstanding job
Oh, yeah.
in meting out justice as she sees fit. All right, well, today we have a big topic to discuss. We talked about it before, but things are moving. It is the topic of budget reconciliation. With a lot of healthcare provisions in that bill, there is some movement, I think, this morning on that, right? So, Jamie, where are we right now with the budget reconciliation bill?
Well, I for one, am very happy that I'm no longer a Hill staffer. I would say the Hill staffers last night didn't get a lot of sleep. I know Alicia has some friends who were on the Hill who didn't get much sleep. So President Trump has been trying to pass this big, beautiful bill, it's called, and it's actually called Big, Beautiful Bill. I'm not making fun or anything like that. H.R. 1. He's been trying to there's been a few conservative holdouts and some moderates as well because of some tax reform. But so last night they put the bill on the House floor at 2:53 a.m. to pass the rule, which is something it's information. It's not important, but they passed a rule.
It's just a procedure.
Yeah,
It's
yeah.
just a procedure. But then they debated it until 6:56 a.m. and passed this massive $3.5 trillion bill. So that happened early this morning, and so we'd say that there were a few conservative holdouts, but it passed 215 to 214, and one Republican member voting present. So this is a major accomplishment for the president to get these Republicans to vote for the bill with his very, very, very slim margins. He could only lose like one vote, basically.
And the speaker.
Yeah.
And the speaker, obviously, too. They worked hand in hand. So.
It certainly did.
But the president went to the House floor, or went to the Congress yesterday or this week to go talk to the congressional Republicans.
Some might say he used his Riz.
And he is Riz, right? That's not the Lulu. Thank you, Alicia.
Yeah, you're welcome.
I read this morning that one member fell asleep and missed the vote. I don't know if that's true or
really?
not. Yeah.
Oh, no cap?
No cap.
Probably a dim. I mean, I just remember when I was on the Hill, we voted for the Medicare Part D prescription drug plan. They kept us there all night.
Oh, I
and
was
they
there for
locked
that
the
vote.
doors,
Yeah.
And the leadership locked the doors because it was
Locked the doors.
Oh, yeah.
Oh, yeah.
Vice President Cheney was on the floor,
Yeah.
twisting arms. I was in the gallery because I was at CMS at the time.
And
See how I turned this back into me?
Yeah.
And they were,
Yeah.
the hammer, Tom DeLay was
Tom
there.
DeLay, yep.
Very effective at getting people to vote for things.
Mm-hmm.
That was interesting.
So skibbity. My guy is just dying over there. All right. And no more Gen Alpha stuff. I understand. Mike's upset. No thank you notes from Mike this week. Okay, so the bill passed. Hill staffers were basically up until 7 o'clock this morning. And so it's a big accomplishment for Speaker Johnson and President Trump. For AMJ's perspective, what was in the bill that our members need to think about?
Well, there's some Medicaid reform, $625 billion worth of changes and cuts to the Medicaid program, mostly around work requirements. There are other, basically, if you're an able-bodied Medicaid beneficiary without dependents in 19 to 64, you need to work at least 80 hours a month. It's requiring states to assess the eligibility of the Medicaid expansion population. There's also some co-insurance, co-pay requirements for expansion population, and certain higher income Medicaid beneficiaries will have to pay more co-pays. And then it eliminates income-based special enrollment periods for the Affordable Care Act exchanges. So that point being said, there is a lot of reform in this, but there was, at the beginning of this, there was more.
Yes, I guess there's so Medicaid's being the big topic
Yeah.
For this bill for the past, I'd say, 2 months. AMGA, of course, opposes the Medicaid cuts, but it started off with, I mean, you're talking probably more than $1 trillion in potential cuts. They're being pushed by sort of fiscal hardliners, which did not make it into this bill. Daryl, give us some ideas of what was being considered that didn't make it.
That didn't make it. Yeah, there were some significant FMAP changes, federal matching percentage. That's the rate the federal government pays versus the state. And they wanted to increase the share that the states are responsible for, specifically for the ACA expansion population. So
Which
that
is 40 states.
40
right?
states,
And DC.
yeah. And so under the Affordable Care Act, that was as high as 90% for the federal government was going to pick up 90% of the share, and they were going to ratchet that down. And essentially they wanted to shift that onto the states. So that didn't make it in there. And that, I spoke to some members recently, part of one of AMJ's regional meetings, and they were seriously concerned about that and the ability of the states to sort of pick up that cost. And so that's not having that in the bill is very significant.
Okay, that was a big deal.
Yeah.
And I do believe provider taxes were on the table for a long time.
Right. They were gonna limit the ability provider taxes, the ability of state governments, tax providers, and then draw down additional federal funding. Various proposals were floating out there to eliminating them, to capping them, and that sort of thing. So it seems like this didn't make it into that bill that passed.
Yeah, there was some provider tax reform, but like the idea of moving the old harmless from 6 to 3% or 5%, I can't even remember the exact numbers, but for certain states it was billions of dollars.
Right.
Yeah, I think so. If you eliminated the hold harmless provision, it's a safe harbor provision to zero, it'd been a $600 billion cost or savings to the Medicaid program.
Savings to the feds.
And I believe if you cut a 1%, it'd been a $42 billion fix. So that was a big issue for the members, and apparently that's out. They did freeze the provider taxes as is right now.
As is.
So they can't change, but no cuts.
Right. So essentially grandfathering in the existing state financing mechanisms, which is, the fiscal, to Chet's point, the fiscal hawks were pushing that very hard.
Last night they were.
Yeah. And then state directed payment, major reform did not get included in this bill that could have cost each individual state billions of dollars. In the expansion population, there was possible creating a per capita cap, right? And that was going to save hundreds of billions of dollars.
Yep. Yeah, $500 billion.
And so that was not included as well.
All right. So there are some Medicaid policy / cuts that will definitely impact the members. But I think a lot of people view this as we've dodged a bullet, at least for now. And then obviously this is going to go to the Senate where we will continue our advocacy work. Is that fair to say?
Yes.
Good.
Yeah.
Good. I'm glad to hear that.
Yeah.
Yes.
Outstanding. From our legislative staff
I like
right
you
here.
looked at me like, I don't know.
All right. So Medicaid was a big part, but there's some Medicare issues in there too. Is that right?
Yes. So they provided they addressed the conversion factor. They didn't fix the cut that went into effect January 1st.
Yeah.
In 2025, January 1st. That was a 2.8% cut. But they have partially tied the conversion factor to the Medicare Economic Index, the MEI.
And that's
Going
a
forward.
big deal. They're including an inflationary update for Part B. And that's something we've been pushing for a long time. Now, it's not exactly what we were pushing for, but I think it's a start.
And I think it said. Go ahead.
And so flesh this out. So 25, no relief. 26, is 3/4 of the MEI. Is that right for Part B conversion factor
Yes.
increase? And then
Yes.
in 27 moving forward in subsequent years, I believe is the alleged text language, it is 10% of MEI, right? So a decent fix for 26 and then sort of gets lower at 27 moving forward, which gives us an opportunity to talk about this some more. Is that right?
Yeah, and I think like in the past, these conversion factor fixes were going to score at 1 billion, 1.5 billion. The number for this fix is more like $8 to $10 billion. So it's more significant. But I will say, as Daryl mentioned, this is kind of a foundation. There's going to be better funding for for MEI and things like that. But this gives AMGA members an opportunity to go in there and say, listen, we appreciate the patch, but here's some ways we can reform the Medicare system going forward.
Yeah, no, I think that the concept, having a mechanism in Part B that, excuse me, on paper at least, acknowledges that costs are going up. Like it's got that inflationary update. Like it's a percentage of it, so it's not a total win, but the concept is now there. So we can start working away on that, and I think members of Congress and CMS recognize that ultimately 10% of MEI isn't keeping up with cost down the road. But like I said, that baseline is there now.
All right. Right. And so someday we're going to have at least one, if not two podcasts just on the macro value task force, because the task force talked about program sustainability as well.
Right.
And this is sort of related to that. Is that right?
It is. Yeah. We've got a whole chapter in our task force report that's going to come out in mid-June, just in time for our Capitol Hill Day. And the idea that you need a sustainable, predictable payment update in Part B was sort of the linchpin to that entire argument, and we landed on using the Medicare Economic Index or a comparable metric as an inflationary update in Part B. So if this, understanding this is just passed the House, it's still got to go through the Senate and all that, but that framework is now there in this House passed legislation, which is which I think is a big deal.
Okay. Well, that's good, at least for the time being.
Yeah.
Okay. Other policies in the bill, Jamie, around the ACA, other issues that are important to the members?
Sure. Yeah. The bill expands and enhances health savings accounts, individual coverage health reimbursement arrangements. It also, this is around silver plans. It funds cost sharing reductions to help certain beneficiaries. Another thing we've been lobbying on, it would be interesting to see the impact of this, but includes policies that tighten the eligibility verification under the premium tax credit in the Affordable Care Act. If those who've been listening and have been downloading our podcast from all over the world, apparently, the enhanced premium tax credit expires into this year. So that's an opportunity for certain people who are above Medicaid eligibility to get access to care. But this bill actually restricts the ability of people to get access to the PTC. So the CBO, I know, is coming out with some analysis on what these could do.
Yeah, so CBO released a preliminary analysis, which means it's subject to change as policy changes, that these policies will cost or reduce spending by at least $625 billion over the next 10 years.
Okay. Those are the Medicaid changes? Is that?
Yes.
Okay. All right.
But it also reduces people's
Yes.
enrollees on things.
So it'll reduce enrollee access by millions as well.
I think it's about 8 million people
8.6
will lose
Medicaid
coverage.
coverage.
Yeah.
Right? Mm-hmm. Yeah. No, that's a big deal. I mean, we talked earlier about we dodged a bullet.
Yeah.
A lot of the cuts that were considered, but at the same time, according to CBO, you have 8.6 million people losing Medicaid coverage. Mm-hmm. Hopefully that does not come to pass. That is not the case, but clearly, work to be done as this goes over to the Senate. So it passed the House, so that's where we are. It is now headed to the Senate. Is there going to be committee hearings on this? Does it go straight to the floor? What's going to happen in the Senate side of things?
I think the answer is yes. It depends because
yes.
it could go to the Senate Finance Committees. That's where a lot of the savings are coming from with Medicaid. It could go straight to the Senate floor, and they do amendments that way. But whatever happens, the House passed package, we assume that the Senate will make their own changes. There's also been discussion of breaking it apart. But this is not the last. The House will have to deal with this bill. So the Senate will do some sort of consideration. The House is supposed to do it before Memorial Day. The Senate's supposed to do everything before the July recess. Right. And so there'll be some sort of, this is a DC term, but a conference, but it may just be an unofficial conference. But from our sources, we've been hearing that the House and the Senate leadership have been communicating back and forth about how they want this bill passed. We'll see in the coming weeks and months what the next step is. But if the president has his way, and he's very effective with the legislature,
at least says a lot of riz.
We could see this bill become law, before the end of July, potentially.
All right. Yeah. So the press is full of stories of how the Senate's going to, jettison a bunch of these provisions and send it back, but we're hearing at the same time that the House and Senate have been working very closely together. Yeah. So a lot of this stuff is of no surprise on the Senate side. We have heard, though, concerns about Medicaid cuts from various Republican senators. What might they do with this? Or do we think this is largely baked? Because I know even the Republican senators that are concerned about Medicaid cuts are still fine with, in quotes, work requirements. But
well, I heard at least that Johnson spoke at a Senate luncheon asking them to keep the bill intact as much as possible to recognize his fragile allegiance that he's got going on. And Thune rebutted a bit that the Senate's going to make some changes most likely. And so we're seeing about 5 to 7 or so GOP senators that might be wanting to make some changes. Keep an eye on Lisa Murkowski of Alaska, Susan Collins of Maine. There's some Senate moderates that are upset with the Medicaid cuts.
Mm-hmm. All right. So as Medicaid is concerned, and I guess even some of those green economy tax cuts, I believe some senators don't want those to go away because they built some infrastructure around that. So a lot of issues for them to hash out in the Senate side. And then you have some senators that say the cuts aren't deep enough, and that this is adding to the deficit, and by golly, what do we do about that?
Yeah, because we said it's $3.6, $3.5 trillion bill, and I would say maybe a third of it's paid for with Medicaid cuts. So I think CBO came out with how much this would impact the deficit is trillions of dollars in the coming years. And so if you're a deficit hawk, this may be problem. And the math, and at least he was getting we're talking about various senators. You can only lose 3 senators on this, really. I mean, I guess you could lose one other and have the Vance break the tie.
Yeah, and Rand Paul's already said that he won't vote for anything that will raise the debt ceiling.
Just said he won't vote for anything.
Kentucky, that's my state.
So you're already down one.
So and you Murkowski or Collins or Hawley, Tillis, Ohio member,
Reno.
Yeah, so there's a few folks, but as we've heard, the president's very effective with legislators getting things done.
Working his riz.
Working his riz. We're saying riz a lot today.
He's going to subscribe to this podcast.
It's on the no list now on the wall. No more riz.
Mike is displeased. Yeah. And that's important actually because he produces this whole thing. It'd be interesting also because the deficit hawks do have some ammunition because Moody's just downgraded the U.S. Because of the debt that we're carrying right now. So that's sort of a big deal. All right. So great. So I guess that's where we are. This is going to be an ongoing story, reconciliation. This will not be the last podcast we have on it. So we welcome you all to continue to listen to the podcast because we will keep up to date on these issues and we will let the members know. Anything further from our expert panel? I guess not. They're gobsmacked.
Yeah.
All right, well, great. Well, everyone have a good day and signing off from AMGA.
Thanks for joining us for Filibusters in Fine Print. This podcast was brought to you by AMGA. For more information about AMGA's advocacy efforts, visit amga.org/advocacy.